Meanwhile, AstraZeneca's chief executive says the results of a study showing its COVID-19 vaccine had little effect against mild disease are concerning. The health ministry and a panel of scientists broke the news on Sunday. Even if you're vaccinated after testing positive for the first variant of the coronavirus, it is still a possibility that you could get infected with the second variant as the virus mutates. The vaccine was developed for the first variant and not for the mutation. It's also been revealed that the AstraZeneca vaccine, the first batch South Africa received from India, has a 6-month expiry period. The vaccine we currently have only has study data for 6 months. Professor Malegapuru Makgoba is the Health Ombudsman of South Africa. He joins me now. Very good evening to you, Professor. It's good to talk to you, especially at this time, a very important time, and I'd like to hear your thoughts about this. So in the wake of these new findings, we've halted the plans to, next week, launch the first immunization campaign with the vaccine and may instead switch to a different one. But I think a lot of people are asking this question: has this been a costly mistake, a decision that could not have been foreseen?
Well, first of all, thank you, Tsepiso, and the listeners of SABC. Let me put a few points at the beginning. First of all, I think the government of South Africa and the people of South Africa have managed the COVID pandemic on a science-based evidence, I think, rationale. So the ordering of the vaccine from AstraZeneca and the decision to pause the rollout have both been decided on the basis of science alone and nothing else. It must also be borne in mind that the original AstraZeneca vaccine was designed against the wild type or the original strain of COVID-19. The new variant B1351 that we have in South Africa, that is driving 90% of our infection, is clearly resistant to this vaccine, as I think the studies of Professor Shabir Mahdi has shown. So we have to ask ourselves as South Africans, and as the minister has correctly made the decision, we should pause and do more studies.
Okay, Prof, and I'm glad you talk about the fact that science has been at the center of all the decisions that we've made. So with the information we've got from day-to-day trials, could or should the government have known sooner that this would be in the offing?
No, I think they couldn't have known sooner because, some of science moves in very slow way than maybe the gossip columns. I think the scientists were discussing this and they couldn't release information that will obviously have eggs on their face. They needed to be absolutely certain that their studies were robust. So it was only, I think, maybe I would say a week or so ago when the scientists, I think, became certain and they could work out the efficacy of this vaccine in our environment, that they decided to approach, I think, the minister and the Ministerial Advisory Committee to engage in the discussion that they had on Sunday.
Professor Makgoba, I think you understand that a lot of South Africans have questions, and I'm glad that we have you to question about this. So you tell us what is in the realm of science and understanding this. So what are the procedures of procuring vaccines? Is there a global standard, given that some of these are, most of them have been, at least in this case, subject to bilateral negotiations as well?
Well, as you know, there are different ways of procuring a vaccine, but each one of them has got rules. You have the COVAX that is organized through the WHO, and then you have bilateral discussions that take place between the companies and maybe various governments, which is what has happened. And you have other mechanisms. All of them have got their own rules. Let me state it up front that the rationale for procurement, I think, in our country was always guided by science, and the rationale to pause the rollout is also guided by science. What is more important is not to imitate what the rest of the world has done, because we are dealing here with a different variant that is resistant to what is available. Now, in Afrikaans, there's a word that says, goedkoop is duurkoop. You can get something cheap, but you end up paying more. So supposing that we're to go ahead with what we have, because we have it, we may pay a heavy price in the end. So I think it was appropriate and reasonable, I think, for the minister and the scientists of the country to let the country know where the problem was and to pause the rollout. It's not the end of the day. We are all disappointed, but certainly we can't use what you may call a fake vaccine to pretend that,
So given that this form of trial and study is how most vaccines are created, and that viruses by their nature mutate, should there have been a fail-safe plan? Is there ever room for this?
Well, that plan has already started. I mean, a year ago, we didn't have mutations. We had the original. We devised vaccines against that. Now we are beginning to enter the phase of escape mutations of the virus. And I think science is so advanced that I have no doubt that science will prevail and we will be able to produce and adapt, I think, to the new variants that are emerging. Okay. So I think as South Africa, working with the rest of the globe and the rest of the advanced countries in advanced companies, we should be able to adapt to the new variants that are emerging and adapt very quickly. So we're not going to have the old vaccine in South Africa. We will have to have something new or a combination of new things. But it can only happen when you have done a proper phase 3 clinical trial.
But there's also a very important thing, Professor Makgoba, because as you say, some of us could not have been foreseen, but there's the issue of cost. So you're saying there is a need for a totally new vaccine, but some of the scientists, including AstraZeneca, is saying that even though the vaccine isn't effective in mild to moderate symptoms, it does mean that it could be effective when it comes to the more severe COVID-19 cases.
No, that is not rational. Mm-hmm. If the vaccine is not effective against mild and moderate disease of this variant, it cannot be then effective against the severe form of the same variant that is not effective against. I mean, there's just no logical rationale for that.
Okay.
It is clearly effective against the traditional virus in moderate and to severe disease, and it prevents, I think, hospitalization and death. But you can't extrapolate in this variant that when it is not effective against the mild and moderate, is going to be effective against the severe. Mm-hmm. I think that is scientifically irrational.
Okay. Now, here's another important issue, the issue of the expiration date. So the stability data that we have is for 6 months, I believe. So should that become available for longer periods, will we have a better understanding of the timelines around the vaccine's efficacy?
Well, I think the Ministerial Advisory Committee has said that we're going to stop, but we're going to have a stepwise approach so that I think what we already have here in the country can be useful in one way or another to understand the dynamics of these old vaccines, if I may call it that way, against what we have here in South Africa. So there will be a new study that will emerge, I think, from the people that are already familiar with the clinical trials to try and assist our government and the people of South Africa to come to a rational conclusion that is again guided by the science that emerges from the studies.
Okay. Now, I'm sure you've heard the skepticism around this latest news from laymen. We know that we expect the J&J vaccine soon. Could it face similar challenges if they use a similar viral vector?
No, because I think the new designs will incorporate the mutations that are occurring. In fact, those studies have already begun to generate the new new forms of immunogens that are going to be used to develop antibodies against the virus. So, as I say, I think science will prevail. Maybe we just need to be a little bit more patient. And also, I think the scientists of the country and the Minister of Health have been transparent and open. And let's give them that space and not despair. I have no doubt that at the end of the day, we shall prevail. And we will only prevail by doing studies of our own that relates to the problems that we have in South Africa. And no other country's solution is going to solve the problem for us. It's going to be our data, our information, our people, and the decision of our government to try and rescue what has happened at the moment.
Very much appreciated your time and your insight, Professor Malegapuru Makgoba, Health Ombudsman of South Africa.